Type 1 diabetes is a chronic condition. It affects how your body uses glucose, which is a type of sugar that's actually your body's main source of energy. In type 1 diabetes, your immune system mistakenly attacks and destroys the insulin-producing cells in your pancreas. Insulin is a hormone that acts like a key, letting glucose from the food you eat enter your body's cells for energy. Without insulin, glucose just can't enter your cells and instead builds up in your bloodstream. This leads to high blood sugar, which over time can cause some pretty serious health problems. Type 1 diabetes was once known as juvenile diabetes or insulin-dependent diabetes. It usually develops in children and young adults, but honestly, it can appear at any age. Type 1 diabetes is different from type 2 diabetes, which is actually the more common form of diabetes. In type 2 diabetes, your body doesn't use insulin properly, a condition called insulin resistance. At first, your pancreas makes extra insulin to make up for it, but over time, your pancreas just isn't able to keep up and can't make enough insulin to keep your blood glucose levels normal. Both type 1 and type 2 diabetes can lead to chronically high blood glucose levels. This increases the risk of serious complications like heart disease, vision loss, and nerve damage. Understanding the difference between these two types of diabetes is really crucial for proper diagnosis and management of the condition. Type 1 diabetes can affect anyone, regardless of age, gender, or ethnicity. While it's more commonly diagnosed in children and young adults, it's not limited to these age groups. The peak ages of diagnosis are between 4 and 7 years old, and then again between 10 and 14 years old. Although the exact causes of type 1 diabetes aren't fully understood, certain risk factors can increase a person's likelihood of developing the condition. These include family history. Having a parent or sibling with type 1 diabetes significantly increases your risk. Genetics also play a part. Certain genes are linked to a higher susceptibility to autoimmune diseases, including type 1 diabetes. Environmental factors like exposure to certain viruses or toxins may trigger the autoimmune response in genetically predisposed individuals. It's important to note that not everyone with these risk factors will develop type 1 diabetes. Similarly, some people with no known risk factors can still develop the condition. Understanding the risk factors can help with early detection and intervention. If you have any concerns about your risk or your child's risk of developing type 1 diabetes, I really encourage you to consult your healthcare provider. Early detection of type 1 diabetes is crucial for preventing serious complications. Being aware of the warning signs and symptoms can help you seek timely medical attention. The most common symptoms of type 1 diabetes often appear suddenly and may include frequent urination, especially at night, excessive thirst and increased fluid intake, unexplained weight loss despite normal or even increased appetite, increased hunger even after eating, fatigue and weakness, blurred vision, slow healing sores or cuts, and frequent yeast infections. If you or your child experience any of these symptoms, it is essential to consult a doctor as soon as possible. Early diagnosis and treatment can significantly reduce the risk of complications associated with type 1 diabetes. The exact cause of type 1 diabetes is unknown, but scientists believe it is an autoimmune disorder. This means the body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. Genetics play a significant role. People with a family history of type 1 diabetes are at a higher risk. However, most people with type 1 diabetes do not have a family member with the condition. While the exact trigger for this autoimmune response is unclear, researchers suspect that environmental factors, such as certain viral infections, may play a part. These factors may trigger the immune system to attack the pancreas in genetically susceptible individuals. Other potential risk factors that are being studied include geographic location. The incidence of type 1 diabetes is higher in some parts of the world, suggesting environmental influences. Race can also play a role, as certain ethnicities, such as Caucasians, have a higher risk of developing the condition. There's even some research suggesting a link between early introduction of cow's milk or gluten and an increased risk of type 1 diabetes. But honestly, more research is needed. Diagnosing type 1 diabetes involves a simple blood test to measure the level of glucose in your blood. If your blood glucose level is high, your doctor will perform additional tests to confirm the diagnosis. These may include the glycated hemoglobin, or A1C test, which measures your average blood glucose level over the past 2 to 3 months. There are also antibody tests that detect the presence of autoantibodies. These are the ones that attack the insulin-producing cells in the pancreas. Another important test is the C-peptide test, which measures the level of C-peptide, a substance produced alongside insulin. Low levels of C-peptide indicate that the pancreas is not producing enough insulin. Once diagnosed with type 1 diabetes, your doctor will work with you to create a personalized management plan. This plan will likely involve regular blood glucose monitoring, insulin therapy, and lifestyle modifications to help manage your blood sugar levels and prevent complications. There's no cure for type 1 diabetes, but with proper care, people can live long, healthy lives. The main goal is to keep blood glucose levels in a healthy range. This means regular insulin therapy, since the body can't make its own insulin. People with type 1 diabetes need to inject insulin to manage blood sugar. There are different types of insulin, each with its own timing and duration. Regular blood glucose monitoring is crucial, usually with a finger prick. Healthy eating and regular exercise also help keep blood sugar stable. Working with your healthcare team helps you manage diabetes and reduce complications. While insulin therapy is essential for managing type 1 diabetes, it can sometimes lead to side effects. The most common side effect is hypoglycemia, or low blood glucose. This occurs when there is too much insulin in the bloodstream relative to the amount of glucose. Symptoms of hypoglycemia can include shakiness, dizziness, sweating, confusion, irritability, and hunger. If left untreated, hypoglycemia can lead to seizures or loss of consciousness. It's really important to treat hypoglycemia promptly by consuming a fast-acting source of glucose, such as fruit juice or glucose tablets. In addition to hypoglycemia, uncontrolled diabetes can lead to long-term complications affecting various organs, including heart disease. High blood glucose levels can damage blood vessels, increasing the risk of heart attack, stroke, and other cardiovascular problems. Nerve damage is another risk. Excess glucose can injure nerves throughout the body, leading to neuropathy, which can cause numbness, tingling, pain, or weakness in the hands, feet, and other areas. Kidney disease is also a concern. Over time, high blood glucose levels can damage the small blood vessels in the kidneys, impairing their ability to filter waste products from the blood. And finally, eye damage. Diabetes can damage the blood vessels in the retina, the light-sensitive tissue at the back of the eye, which can lead to diabetic retinopathy, a leading cause of blindness. Living with type 1 diabetes means ongoing care and attention to your health. But with the right tools and support, you can live a full and active life. Take charge, manage your condition, stay informed, and work closely with your healthcare team. Consistency is key. Stick to your insulin, meal plan, and exercise routine. Check your blood sugar often and see your endocrinologist. Connect with others. Support groups and online communities offer encouragement and advice. The future is bright. New treatments like the artificial pancreas and research in immunotherapy offer hope. Remember, you're not alone. With care and support, you can thrive with type 1 diabetes. Don't forget to subscribe. Want to learn about type 2 diabetes? Click the link for more medical videos.